So, as far as one thing that they've been looking at is the intestinal dysbiosis linked to MS. And dysbiosis, there are a lot of patients that actually deal with this. It's a condition where the gut bacteria becomes imbalanced, very imbalanced.
Welcome back to the MS Workouts channel. My name is Jeff Gott, and my guest today is Dr. Lori Mayer. She's a nurse practitioner with decades of experience helping those living with MS navigate their symptoms in a clinical setting. She recently hosted a live presentation with our clients of the steadypace Club about MS and the microbiota that I really think is going to help you in your fight against MS. But before I pass it off to Dr. Lori Mayer, I just wanted to remind you that our January 2024 promotion for the steadypace Club ends tomorrow, January 31st. Y'all, I know that you're probably sick and tired of hearing about the steadypace Club, but I wouldn't be talking about it so much if I didn't truly think that it would make a difference in your life. Science and research proves that strength training is one of the very, very best investments that you can make to reduce your symptoms. So why or what are each of you waiting for, okay? Just go to www.msworkouts.com to learn more about our club and enroll in that annual plan paid monthly so you can join with amazing savings for 2024.
Thanks all for being here. I enjoy coming, for these monthly visits. But today, what I wanted to talk about was MS and the gut microbiota. Okay, it's called a variety of different things, gut microbiome, just the gut, the microbiota, whatever. There's a lot of research that's being done, on the specific, the gut, as far as the immune system. So as far as looking at a medical perspective, there are a couple questions. Is there a connection between intestinal microbiota, our eating habits, development of chronic degenerative diseases? Okay, this is something that they're all investigating right now. So does the gut microbiome play a role in health and disease? You're going to hear a lot more about that down the road. And does the microbiota trigger an immune response? And does it affect the gut-brain axis? And I'll talk about that in a bit, explain that a little bit. So really, what is the gut microbiota? Anyway, it's a colony of bacteria. It's bacteria that inhabit in the gut, and we call it the gut microbiota. It varies in composition, and it varies according to your genetic factors. And more importantly, some of the environmental influences are just as important, particularly the diet. Okay, the microbiota it contains an abundant microbial community. There's more than 100 trillion microorganisms. So the composition influences the production of serotonin in the gut, which actually in turn influences serotonin-mediated regulation of systemic immune function. So this is just a small smattering overview of a very complex process that actually undergoes. But the gut is very much involved in the immune system when it really comes down to it. Okay, let's see. One second. I have to go back here. Okay, so just to go over some human anatomy, you can see the gut actually involves not just the small intestines, okay? It does involve the large intestines. The colon is very much involved. And it all influences responses in the periphery and the central nervous system. MS involved, it's all central nervous system. It's the brain and the spinal cord. So what goes on in the gut actually influences what crosses that blood-brain barrier and affects the central nervous system. So we think that the gut microbiota actually may have a role in MS through the influence on the immune function, although we don't know exactly what it is or how it is. However, they're doing some investigation, and I'll talk about one of the most recent research that they have. So, I mean, when we talk about it, it's a very complex ecosystem, okay? And it's got more than 200 uh, genera, but most representative we see are the Clostridium, the Lactobacillus, the Bacillus, and the Enterococcus, and the Ramunococcus. Okay, so the one I want you to remember is the Clostridium one, because that's the one we're going to talk about the research. So we have many different configurations of microbiota that can actually lead to the same result. So it's going to be very individualized for each person. It has a lot to do with the genetics as well as the environmental factors that we see. So what's the gut-brain axis? Okay, so this really is, it's a bi-directional communication, and it's the communication that exists between the gut and the central nervous system. And this is what they're focusing on. They are looking at the neuronal connections, the general neuroendocrine and humoral pathways in the immune system. That's how complex this all is. So the central nervous system can communicate directly with the intestine via two different branches, what we call the sympathetic and the parasympathetic of the autonomic nervous system. And so it's particularly via what we consider as the vagus nerve. Microbiome can be modulated directly by bioactive molecules released by the enteric nervous system or directly through other mechanisms that modify the microbiome environment, such as GI motility, permeability, pH value, or mucus secretions. Now, I know that all sounds kind of scientific and maybe a little bit upper level, but it just reiterates how complex the immune system in the gut actually is and how it's involved. So as far as one thing that they've been looking at is the intestinal dysbiosis linked to MS. And dysbiosis, there are a lot of patients that actually deal with this. It's a condition where the gut bacteria becomes imbalanced, very imbalanced. And it can be a wide range of digestive disturbance symptoms. So it can be diarrhea, it can be cramping, it can be constipation, it can be bloating, and it can be indigestion. Now, not your inflammatory diseases, though, not your ulcerative colitis, which is different, or inflammatory bowel disease. That are totally different than some of the symptoms that you are dealing with when we're talking about dysbiosis. So we think that it's associated with mild or severe GI symptoms. So the range is going to be, it's going to depend upon the person as far as what symptoms that you're dealing with. So this is the most recent research. This was just last week. I read about it. It's an article from Dr. Tim Vartanian, who is actually at Cornell University. And what they're feeling is that that bacterial toxin in the gut actually may trigger MS onset and may trigger the relapse, which is a whole different way of looking how the immune system is actually being affected. And the only reason that, and they've got samples of, stool samples that date back large groups that they're actually looking at, but they've got new technology. So the technology is improving all the time. And so using that within research, what they found was there a higher level of what they call the epsilon toxin producing Clostridium, okay, which was actually within the gut microbiome of the MS patients versus the healthy controlled microbiome. And they found that typically in the small intestine.
Hmm.
So they're wondering if we looked at a therapy that would actually affect that toxin producing level, could we prevent MS?
Wow.
Could we prevent a relapse? We don't know. They're working on it. Things have been tested in the animal models, and they know that that particular toxin itself, causes the breakdown of the immune activity. And what's the immune activity? It's crossing the immune system, your T cells, crossing that blood-brain barrier and going into the central nervous system and doing the damage that they're doing. So I have a link to this article if you want to read the whole thing. It's really, really super scientific, but it's absolutely fascinating. And it's a whole different area of research that they've been looking into. And you're going to see it not just in MS, you're going to see it in a lot of other autoimmune diseases they're looking at. So let's talk about the prebiotics and the probiotics, because these are some things that may help with the intestinal dysbiosis that a patient may deal with. So your prebiotics are specialized plant fiber. It acts as a food for good bacteria, and it stimulates growth among the pre-existing good bacteria that's there. So this is a food plant fiber substitute, okay, that interacts with the bacteria that is already pre-existing in there. Well, and I'm sure you've probably heard about probiotics, right? These are living strains of bacteria that add to the population of good bacteria in your digestive system. So these are two totally different things. So as far as prebiotic foods, here's a whole list of some. And, they're pretty much, types of carbohydrates that we eat these all the time. And it's different than dietary fiber, okay? So we have recommendations for dietary fiber, but we don't really have recommendation for prebiotic foods. However, one thing to keep in mind, the AGA, which is the American Gastrointestinal Association guidelines, do not support the use of probiotics for most digestive conditions.
No.
Okay, so if you've got an inflammatory process in the intestine as ulcerative colitis or inflammatory bowel disease, they actually do not recommend it. Okay, we're talking about something different when we're talking about the dysbiosis that an MS patient actually deals with. So prebiotics on food labels may include, if you look at inulin, fructooligosaccharides, and polyposis, including lactulose. So those are things that you actually might see on if you're reading some of the labels. But we've got a lot of variety of things here. And it's okay to cook the foods that contain the prebiotic type fibers without losing a lot of the benefits. So you can include these in your diet, your whole grain products, your oatmeal, your whole grain breads, asparagus, leeks, onion, garlic, starchy vegetables like sweet potatoes and corn, your beans, your lentils, your peas. These are all really, really good sources. What we do need to try to do is limit our sugar, our saturated fat, and the processed foods, because they cause a depletion of the good bacteria in the gut. So it's kind of a different way of looking about, eating processed foods in general. So it's really important to eat the whole food as opposed to, you want your unprocessed fruits, okay? So just avoid them altogether. We try, we can't totally, of course. We have a lot of things out there that are processed that we all eat, But I think in general, you can kind of focus on including some of these insoluble fiber-rich foods actually into your diet. So your probiotics. So that's the prebiotics. This is the probiotics. This is live bacteria and yeast. They live in the body with many others. There are a lot of probiotic supplements that are actually out there. They're over the counter. So when they work, what happens is the microbes take up actually residence on or in the body, adding to the populations that are already there. Not all probiotics are alike, okay? There are a variety of different types. And I would avoid looking for anything with a high Clostridium count, that you can see it because you can actually look on that probiotic. They aren't regulated by the FDA, so the manufacturers don't have to prove the quality or even the context of their products. So this is something that you can talk to your healthcare provider, your primary care doctor, your neurologist about what actually might work the best for you. So some of the most frequently studied and recommended ones actually include the lactobacillus and the bifidobacterium. So you can look for those too. All right. They are available over the counter and they are everywhere. Grocery stores, drugstores, health and wellness stores. They come in capsules, liquids, powders, some even topical lotions, although I really haven't seen those. Again, discuss it with your provider, what might work for you. Some come in less concentrated quantities from fermented foods and drinks. And so you can get your probiotics from your yogurt, your cottage cheese, your miso soup, kombucha. I don't know if I said that right, but sauerkraut or kimchi, pickles and pickles juice. These are all fermented things. That is one way you can have bring more probiotics into your GI tract. So the issue again is the food processing sometimes actually destroys them. So you do want to check for the label. You want to look for live and active cultures in that, which when you read the yogurt, it usually tells you with that. While the prebiotics are mostly different fibers, not all fiber is the same. So some studies we know have shown that some may help with the nutrient absorption. So that can actually help with the growth of the good bacteria if those levels are low for whatever reason. If you're eating the whole grains, if you're eating whole fruits and whole vegetables, you're already getting the benefit of the prebiotics right there. So it would depend. Providers might actually recommend the prebiotic for those who have low amounts of fiber in their diet and looking for the specific benefits from that. So the best thing to do is if you have any questions about possible benefits, talk to your healthcare team about that. The National Institute for Healthcare and Excellence, this is what they recommend, that if you wish to try a probiotic, because there's so many different kinds that are out there and we're all very individualized, you can take them at the recommended dose that's actually recommended by the manufacturer for maybe a minimum of 4 weeks. Try it. If it doesn't work for you, there might be certain things they may cause, more bloating, discomfort, issues, may not be right for you. But that advice kind of makes sense for me. It would be at least 2 or 3 weeks that before you probably would see if there was any difference or improvement. And if not, then, there are others out there that you can try. So we're looking into some therapeutic strategies that actually target the microbiota. And there are some dietary interventions, that we're going to see come down the road, but we do have the probiotics. There is a fecal microbial transplantation, which has been done, which is, kind of a severe thing that is available, but we have a lot more further work that we needed to assess the effectiveness of a lot of these different things. Just keep in mind that there are a variety of different things that you can try, and you can try them. They're over the counter. Follow the directions by the manufacturer. And if you end up having side effects with that, then stop that. You can try something different if that's an issue. But before you set your plan, it definitely be worth talking to your primary care provider about that. Okay, those are some of my references that we have. And did anybody have any questions at all?
Is the MS Workout Steady Pace Club really worth the money? This is a question that we get a lot, and it's an important one for you to ask yourself, so let's talk about it. The average price of a membership at a big gym is anywhere between $40 to $70 per month, and that does not include personal training or even group classes. Depending on your insurance and where you live, an average session with a physical therapist costs anywhere between $50 to $175 per session. Each session is usually about an hour long with no time afterwards for questions. The average cost of a personal trainer in the US is anywhere between $40 to $80 per session, and that trainer may not have a clue what MS is or how to help you specifically manage it or reduce those symptoms. Now, let's compare those options to our Steady Pace membership club. The average membership of our Steady Pace club is only $39 per month, but here's what you're gonna get. Symptom-specific workout classes for foot drop, hip flexors, weak grip, balance, and much more on a weekly basis. Weekly live workout classes, that's what I said, live workout classes by our trainers so you can perfect your form and make sure the intensity and specificity is there to develop the results you're looking for. Weekly live Q&As where we have time to help you answer your questions. It's with myself and our team so we can connect directly and make sure you're dialed in. Support groups, so you can be uplifted when you're feeling down by individuals that are living with MS just like you. Stretch classes for when you're feeling tight and you need that active rest recovery in specific areas. Recovery classes like yoga and our proprietary movement drills that are going to allow you to increase the oxygenated blood flow on a daily basis and not only maintain, but improve your health. Instant access to our MS Online Progress Journal, which is an awesome tool to help you track your progress in real time with charts and easy to use functions. And let me say for a second, it's not just about the price. We have delivered real results to thousands of people since we began in 2017. Clients like Larry, who retired his AFO. Others like Valerie, who is no longer relying on her walker. Nicole, for example, can now grocery shop on her own. All of these clients achieve their goals by strengthening their bodies and neuromuscular system through a science-based steady pace technique, and you can do the same. So don't forget, until Monday, January 15th, you can join our annual membership plan at the low cost of $39 a month so you can enjoy the full benefits of the Steady Pace Club without the burden of a hefty one-time payment of $468, which we know can be a no-go for some of you. Just click on the link below, fill out the form, and then wait a few hours so our team can get your tools together and email you the login credentials that you need so you can access that Steady Pace membership club immediately. Our YouTube channel is a great place to start gaining strength, but if you want to get serious about reducing your symptoms and getting results, then you need to be on a weekly structured strength training program with other individuals just like you. And that's exactly what we offer at MS Workouts through our membership. Click the link in the video or below the video to learn how our membership can help you achieve your goals. And while you're on the website, make sure you sign up for the no-cost 7-day strength camp so you can experience how we can help you do the things that you love to do with more confidence. See you all next week.